welcome to GTE Tech Talks. I'm Eva Martins from the Global Technology Executive, and my guest is Güngör Kara, Chief Digital Officer for Ottobock. Today we're talking about digital technology and human mobility. Güngör, thank you for joining. It's a pleasure to have you here today.
Thanks a lot. Great to talk to you.
So we'll dive right into the first question. Güngör, how would you describe the current digital technology industry in the medical sector?
Yeah, I think the medical sector has really grown with the digital solutions. In the past years, we had very good first use cases, but now the solution is getting not even more accepted. It's really rolling out in different sectors. So from pharma also to medtech. And the technology has evolved, and the acceptance not only on the customer side, but also the usage of technology within the leading companies. This has also grown up. And I think we have now entered the next level, and the next level is something which will bring even more and even more specialized solutions for people in the value chain. And also, especially also for patients. So I'm very happy in this decade, we will see a lot of new innovations coming, which were just some first use cases in the past decade.
That sounds very, very exciting, Güngör. How do you see the digital and AI technology evolving and increasing the human mobility over the next few years?
The key driving factors are computational power and cloud storage capacity, and this is growing and growing. So we have even smarter devices together with new sensors, and especially AI, which builds on data which is collected and then processed in a very fast manner, has evolved. So in the last decade, we used mainly data scientists with their special expertise, and the solution were really manually handcrafted, generated. But now you can use also AI engines in the cloud, and therefore you can automatically generate much faster solutions, which even with that brings also much faster results. And this are the evolving steps from big data to smart to value data. And value is what everybody is right now focusing. So as I said earlier, we have stepped out of that use case setting and getting more and more reliable and also valuable solutions. And this will generate a socio-economic impact. So this means we can bring in people with, for example, what we are supporting in the human mobility sector with limited mobility levels, then much faster and closer than back to work, back to life, and increase also their life quality. And these solutions are generated even more and more specific. And this is why digital and AI are evolving, plus the usage, plus the easiness to use this kind of technology. So therefore, it's the perfect time in life.
That's fantastic. It's great to see how technology can help such a great deal in the quality of life to people. What would you recommend in that respect to the industrial logistics and the trade industry? How can physically demanding jobs and workplaces become more ergonomic and human friendly with the help of technology?
Yeah, I think this is a big issue, because the physical level of stress which people feel doing these heavy work is really significant, and only very few people get really old at getting into retirement in that kind of jobs, because it's so demanding. So definitely what has to be done, it has to be a baseline created, and here you are also AI and also computational solutions can be used by analyzing the workflow and analyzing the forces somebody has to deal over the entire day. And here with some video motion capturing and also analysis of the working processes, you can then see what can be improved. And then it's two actions which will bring results. First, the workflow at himself. And if you can change the workflow, Then people need support, and it could be a bionic exoskeleton. It could be also further mechanical, but mainly also electrical powered solution, which really increases also the easiness to use this kind or to handle this kind of jobs.
That's very interesting, very exciting. And how does Ottobock increase human mobility and helps users prosthetic devices specifically with technology solutions?
Yeah, I think what we have done in the past, we have increased the smartness of our prosthesis. So we have created apps, we have created connectivity, and with that connectivity, the prosthesis was able to talk on its own to the user, the patient, and was also building a digital connection bridge to the clinical expert, the technician, the orthopedic person who also takes care about the patient. And if a device has that kind of ability, then it opened up completely new solutions. And we have seen that during the pandemic, where people were not willing to go to a patient care center, we could support them remotely. So this was also the first phase. And the second phase, we created a platform called Scan to Walk. And within that platform, we combined our solutions. So we have solutions for the patients using the prosthetics. We have a mobile gait analysis, which we then combine with the life cycle of the prosthesis. And then we have also scanning devices, which can scan your body posture, your gait, but also the fitting of the prosthesis. If you merge all this kind of information, then you have a multidimensional digital twin. And this is where we are heading to, bringing more smarter solutions in a holistic manner, and always having the patient, the user in the core of them. And this is what we have pushed, and this is what we are now trying to bring to the next level.
That sounds all very innovative, Güngör. That's really exciting. What other innovations can we expect in the next, let's say, 18 months or so?
Yeah, what we have brought out in the US last year, this was the product Micro. It's a cranial helmet device developed for children with disabilities and deformation in their head. And this is based on a scanning and digital modeling, a 3D printed patient-specific helmet. And that kind of helmet brings in a lot of advantages. And this was the first one which received an FDA approval for a digital process, including a 3D printed helmet. And based on that, we're working now on the second version. So we bring out an even advanced solution out of that, just to challenge also ourselves and to be always on the front end, be a front end runner in terms of innovation. And then I mentioned also Scan to Walk, which is a holistic approach. And this approach we are now step by step implementing in the US. So the first patients received that 360-degree service. We opened up new patient care centers end of last year. And this is something where we will focus on this year to really grow that and also serve real patients with full digital solutions within our own patient care centers with these kind of solutions. These are the ones, the two topics you will see definitely in the next 12 to 18 months.
Very exciting times ahead then. It's going international, and yeah, it's just great to see how technology can help lives, help the quality of human beings' lives. And yeah, it's just amazing. Thank you so much for your time today and for sharing all these insights, Güngör, and I hope to see you soon.
Thank you very much. It was my pleasure. Bye.
Bye.